ignorant of a situation, we assume it does not exist. Just like the ostrich that put his head in the sand and says, since I can't see people, people cannot see me. This is what the kind of attitude we used during the COVID-19 period. A lot of leaders, world leaders, and conspiracy theorists, they are all there saying, the COVID-19, as we're not seeing it now, is not existing, but it wiped out a lot of people. So I want to tell you that thought process is highly flawed. Good morning, you're listening to Health Plus on 98.3 Mainland FM, the sound of Lagos. My name is Lilian, and on Health Plus we give you information about your health that can help you, because if you don't have sound mind and body and healthy body, there's nothing you can do. If the engine is bad, there's nothing else that can work. Okay, all this money we are chasing, paper chasers with the hustle. Once you have one tiny ailment that disturbs your body, that is it. Okay, now this mindset of being ignorant of a situation and saying that it does not exist, that is the mindset that is shown towards autosomal dominant polycystic kidney disease. They call it ADPKD. It is generally assumed to be rare among blacks in Africa, but it is assumed, though, keyword here is assumed, but it ranks as the third leading cause of end-stage renal disease. So you see that ADPKD is common, and it is as important and an important cause of morbidity and mortality in Nigeria. More than 100,000 cases per year. That is large. So don't you think that this should be enough for us to talk about it on Health Plus? I think so. You see, in more developed economies, the diagnosis of this disease is now made easy, because as early as the first decade of life, they diagnose it due to the advancement of gene technology. However, in insurance and resource-poor settings like sub-Saharan Africa, where the diagnosis of ADPKD is still restricted to clinical judgment and renal ultrasound, it is not enough, and this has hampered knowledge about the disease. So to talk to us today about today's topic is Dr. Nwadinigwe Emeka, the Chief Medical Officer of Zenith Medical and Kidney Center, Lagos. When we come back from this break, he's going to say hi to you and dive right in, because he's so passionate about this topic. He said, Lilian, let us do, in fact, it was his idea. Let us do this because a lot of people don't know about this, and that is disastrous. We'll be right back. Told you I'm not alone in the studio. I am with, let us call him Dr. Emeka for short. Good morning, Doc.
Hi, good morning. I like the way you pronounce my surname.
Nwadinigwe.
Yeah.
What does that mean?
The child in the crowd. Say the whole family stuff.
Can you tell us? I'm curious.
They gave birth to a lot of children, like ancestors and stuff. And there was only one that survived. Like out of it all, only one remained.
Okay.
And they called Nwadinigwe, child in the crowd.
Oh.
Yeah.
The one who stood out.
The one who stood out. Idea.
Okay, that is really nice. We learn every day. And today we're talking about autosomal dominant polycystic kidney disease. This is a mouthful, don't you think?
Yes.
When you told me about this, I thought to myself, I said, which one be this one? Which one be this one like this? But then I made my research, and this disease is more common than a lot of people think. In Nigeria, just like everything that happened, they'll say it's typhoid and malaria, right? So a lot of things, people have this kidney disease, but they just think it's just ordinary, it's normal, but they don't know that it is a big issue. So why did you choose this topic?
All right, so I'll just dive in here and tell you that in the past 3 or 4 days, I had seen 4 patients.
4 patients
that came down with kidney failure secondary to this disease. 4 patients in
Wow.
the past 1 week.
Wow.
Yeah.
So let's talk about it real quick, right?
Yeah.
What is autosomal dominant polycystic kidney disease?
All right, let me. I'll just break it down because
In the lamest of terms, the
Yeah.
layest.
All right, so we have autosomal dominant. That's genetic stuff. It just means that if one parent has it, the chances of the children or any of the child having it is 50-50.
Okay.
Means if one of your parents has it, there's no, it might be there, it might not be there. No, you will have it most likely. Like it's a 50% chance.
Okay.
So, and if you have it, you would actually the symptoms will manifest. There are some diseases that, let's not to go into genetics. Let's leave that one. So autosomal dominant.
Just means that
When one parent has it,
Yeah.
any of the child has a 50% chance of having it.
Okay. So.
Polycystic, poly, plenty.
Oh.
Cyst is like water filled sac. You know,
Yeah,
when
yeah.
you put water in a balloon.
Yes.
That's what it is. That's how a cyst looks, and it's very thin and all of that. Kidney disease. Everyone knows what kidney disease is.
Yes.
So that's also, it means a kidney disease that occurs from plenty cysts on the kidney.
Okay, so the kidney will look like a lot of balloons.
Plenty, exactly.
And if it bursts,
you know, it can get infected, it can burst, it can damage. So it compresses on the kidneys, and it can replace the kidney cells. Doesn't allow
its own.
Yeah, that kind of vibe. It won't allow the kidney cells form.
Okay.
And that's what damages the kidney most times.
Whew. Okay. When they tell me that there's a large chance of someone getting something because a parent has it, I always imagine the first person that had it. How did it happen?
May we track that person down.
May we track them down. So how did it happen? If right? So aside genetics, which other way can one get this disease? Like what other causes?
It's a genetic stuff.
So there's nothing I can be doing now that can increase my chances of getting it.
It's there are things that you can do that can worsen it or cause it to worsen. You understand? There are things like smoking, like having some other medical conditions associated with it, like hypertension, diabetes. Some of these other issues can worsen it. You understand? But the one thing that has been found to cause it is genetics. If your parent has to have it, for you.
That's why they even named it autosomal. So it's
so you go
parents thing. So
you
know who you go.
It used to be called. I think it used to be called adult polycystic. I don't know what this is.
But then I heard that kids they can diagnose it in kids as well. So they have to scrap out the adult part.
Yes, exactly. So it can occur in kids, but now there have been new technology that can actually detect the gene. You understand? You do some genetic testing and you can find the gene. Oh, okay, this person has the gene to this thing, and then we start treatment from there. So they just took it away.
All right, let's talk about signs. How would you know? What symptoms would you see to know that one has that polycystic?
It's basic kidney symptoms.
Imagine I don't know.
No, wait, sorry. So it's not like that's why I'm saying it's basic kidney symptoms, because you need to know that it can happen like any other kidney problem. Do you understand? Symptoms like protein in your urine. Some people have protein in their urine. Their urines are usually foamy.
Oh.
Yeah. So you see foamy urine. You can have swelling all over your body. You understand? You can have usually in the legs. The person can have swelling around the eyes. They call it puffy eyes. First thing in the morning, your eyes are puffy, your legs are swollen. Your eyes are puffy. Then later on in the day, you find out your legs are also swollen. All those kind of things, and you're like, what's happening? And then you can also notice that your body is itchy. It's called pruritus. It's usually as a result of so your body has what is called waste products. Whatever you eat, the body takes what it needs and then discards the rest. Most times what you eat produces what's called the waste product of what you eat is urea and creatinine. It's usually discarded by the kidneys. Do you understand? Normal. They do every day. Every
that's their job.
That's their job. They will just remove it plus other things in your urine.
Yeah.
You understand? But now when the kidneys are not working, when it has damaged the kidneys to a point and is not able to work again, these chemicals, these waste products, just like feces. Imagine feces accumulating in your body. You understand? They accumulate in your body and they cause symptoms. The symptoms are usually what is called uremic symptoms. Some of the symptoms, itchiness, it's called pruritus. Your body will just be itching you. There's whole puffiness and everything. There's abdominal pain. Person can have what's called uremic gastritis. The person is like ulcer. The urea will just eat up the stomach. I don't know how. I cannot really say how it happens, but it will cause something like that. It's like ulcer. There's it can affect your heart, can affect your brain. It's everywhere. It causes uremic pericarditis, uremic encephalopathy. You know, it can affect a lot of. And then one of the things you would also notice is that you will not be making urine as much. The person will not be making urine as much. First, the person will be
foamy urine.
The urine can be foamy. So all of these things might not happen together.
Yeah.
You understand? It can happen. It can happen separately. You might not notice until it's already too late. Do you understand?
Yeah.
And then person is not making urine. Or person used to go to toilet like 4 times in a day. Now they stopped. It's now once. They are now saying that it's not even as much as it used to be.
Yeah.
Oh, these are some of the symptoms of the whole kidney disease.
Okay.
And it's not peculiarity to the ADPKD.
Okay.
When we go ahead, I'll tell you some of the peculiarities of ADPKD.
All right. We are on Facebook and on YouTube. If you want to follow us live, or you want to check out, the studio, you want to watch it live on Mainland 98.3 FM, just search us there, and you will see us live. Okay. And also, if you have any questions, you have any inquiries, anything you want to ask us, actually, the good doctor here will answer those questions. Just send them to 09136000410. So first of all, I want to just take you back to when you said swelling in Nigeria. If somebody visits the village and come back, you hear after he came back from the village, his legs started swelling, he has match poison. Do you know, I knew someone who this thing happened to. This person said having swelling in the leg, and because he just came back from the village, they said they don't put jazz for, I don't match up. It was now later now they were checking this thing, and they found out that he had kidney disease, but it was already too late. May so rest in peace.
Amen.
So it's not everything that is spiritual. If you have any symptom in your body, go to the doctor. They used to say, go see your doctor. Go to the hospital. Check out yourself first. Eliminate every physical before you now start looking at spiritual. That's if you're a spiritual person. So let's talk about the peculiarities of this ADPKD.
All right. So as I said earlier, it is a kidney disease that occurs when there are plenty cysts or explain sister. How would we know that this is ADPKD? We just do an ultrasound scan, an abdominal ultrasound scan.
Is that enough?
That's enough. Once I look at it and I see plenty cysts on it's pathognomic. It's like what we call pathognomic. Sorry, that's a big word. It's like once you see it, yes, that's it.
So it's very glaring.
It's very glaring. Like Usually, this is what we usually see in the hospital. A 29-year-old lad or lass, right? It's a 9-year-old man or woman comes into the hospital and they're like, "Oh, doctor, I just want to do. I just want to check. Maybe I have malaria or something." And I check the blood pressure, and it's like 220, 130. Normal blood pressure, guys, is 120, 80. Usually less than 130, 90. But 120, 80 is your normal blood pressure. And that lad comes in with 220, 150 or 130, and I'm like, this is a 29-year-old boy, a 29-year-old man. He's not up to 40, and his blood pressure is that high. I'm like, that is the first thing that I should think of as a medical doctor, as a nephrologist, or as in renal care. That's the first thing I would think of. Oh, this guy's blood pressure is too high for his age, and what I will send him for after doing all the normal tests, I will do some normal regular tests. I will send him for an abdominal ultrasound scan. Okay. Because I am thinking, immediately I see that blood pressure in him, I'm thinking ADPKD. This is occurring ADPKD. Then I would have asked him a couple of questions like, oh, okay, how are you? How is your dad or your mom? Do they have any medical conditions? Do they have anything that they are managing? All those kind of things. I need to know if the dad is late, do you know what killed the lad? If the mom is late, do you know what killed the mom? These kind of questions. Did they have hypertension? Did they have diabetes? I want to know some of this. I
think we should start doing this more often. Like everybody should just go check for the sake of their children, at least, even if you won't like yourself.
Exactly.
Like your children enough to know what's happening to you.
Exactly. So I had this. One of the patients that I had. It was he was telling me how it all started. He says he walks out, he takes care of himself, he doesn't drink, he doesn't smoke, like he manages stress. You see the guy no get wahala.
He's supposed to be in top shape.
Do you get? And he tells me he swims. He tells me he swims. Bro, I did swim. Swimming you got you get time for body. You get you have to. It's an exercise.
It is a full exercise.
It's a full body exercise. For me, they collect energy. You get. And this guy tells me he swims, and I'm like, he didn't know. If his father or his mother knew that they had this condition, he would have known and he would have taken care of himself. But he didn't know. That's why he has kidney disease now. His kidneys have failed.
Oh boy.
And he's on dialysis. Do you understand? And he takes care of himself. Do you get? So I told him that, oh, you know that it's hereditary, yes? And he said, yes, of course I know. He's educated, so he knows. Do you understand? So he knows. It's just that he didn't know
he had it.
Do you get?
He's educated, but his parents didn't educate themselves.
Do you understand? It's not. Now, here's the thing. I read something. I'm about to go. There's what we know as known knowns, known unknowns, and unknown unknowns. Say
that again.
Known knowns, known unknowns, and unknown unknowns.
So that was a known unknown.
That's the thing. To his father and his mother, it was an unknown. It was an unknown known. Do you get?
Yeah.
They didn't know.
Yes.
That it was there, but because it never came to their path. That's why, like, I want to do whenever I catch people, an audience, I educate them on the things I've learned. Yeah. Because I know there are the things that is known, but you don't know.
Yes.
And that's why education is important. Yes. Medical education awareness is important of varying things. That's why I wanted to talk about this, so that everyone that's listening will now know, and they can tell. It's like a virus. I want to infect you with the knowledge so that you can infect other people with the knowledge, and then I've spread the message like that. So you are there. You are a 29-year-old person, and you're checking your blood pressure, and it's 200, 150.
For what?
You are 35 years old, and you've not checked your blood pressure in the past 20 years. You've not checked your blood pressure because you are okay. I'm about to get angry with some people on this radio station. You've not checked your blood pressure since they born you.
At a certain age, we will stop blaming our parents because your parents have done that. Now you're an adult. Start righting those wrongs.
By the time you're 20 years old, I suspect that you should be living on your own, like staying on your own
even if in school or wherever.
You get, and these are the things that you need to do. Do you understand? These are the things you need to check. You need to check your blood pressure.
You regularly. See that there'll be an organization doing free checkups and everything.
Bruh.
This one does not have. There's no money. I was in my home yesterday. I think this whole week there's this guy that will come with megaphone and say, "Come and check your blood, your body." Do you know that people did not go there? And then they will be complaining that government
I know a couple of people that their issue is once they go and see the doctor, problem must come out. No.
Well, it's not
true. No, Lilian. I did not wake up every morning to go and be telling somebody about problem. No. That's not what
it's a problem,
I beg. But if there's a problem and we detect it early, we can initiate treatment early.
Okay, let's talk about early detection of ADPKD. That is, let's say, what's that again? That is autosomal dominant polycystic kidney disease, right? So, is there any difference? Is there any difference? Would it make a difference if I find out, when I'm 14, and if I find out when I'm 40?
Of course.
Can you tell me what difference?
Of course. There are times that they can, because most times it might not always be the two kidneys that are affected.
Okay.
So it can be one. And then they can do surgeries to take it out if it's thoroughly infected.
So that it cannot affect the next one.
You understand? Or so that it doesn't cause like further damage and all of that. We begin to manage you. When we find out about it, oh, okay, I knew I have this thing, so I have to watch myself. I told you there are some things that can precipitate it.
Yeah.
Worsen it. Like smoking, like alcohol, excess alcohol intake.
A lot of people do now.
Do you get
water?
Do you understand, man? Smoking is bad. I'm not even
Hanukkah. I'm sorry, shisha.
I don't know about shisha. I have not really read a lot about shisha. I saw one thing that, can I call a name on the station?
No,
it's okay. I saw one thing that one popular guy put on Twitter, but I not really follow it up. I don't know about.
Yeah, he talked about the dangers of. I really saw it too. He talked about how it is basically the same because there are chemicals put into that, and inhaling external chemical, whichever one it is dangerous.
See, I don't know about that one. What I don't know, I don't give.
Hookers,
but the one I know, smoking is bad. There is no.
I heard that there's some healthy plants.
There is no.
The plants, yes, people who smoke plants will tell you that it is healthy. In fact, sometimes I'm telling you, so you have to tell me about it.
I'm a medical doctor. I cannot
Listen,
advocate for such.
I'm not saying so you tell me whether or not it is true, right? Maybe it's just what they tell themselves to sleep well at night. So they say that these plants are healthier than tobacco, right? And that's why they take it. In fact, they some people have medical plants.
Yes,
they prescribe it to them.
Of course.
So are you saying all?
No, not all plants. Of course, no.
Even the plants are not
See,
healthy.
there was a movie, recently that I saw. I forgot it was a comedy movie, that I saw that opened my eyes to herbalists.
Yeah.
I've forgotten what they call it. What they call it? That botany. Yeah, botany.
Okay.
So that opened my eyes to botany and how herbalists work. They take every plant, like there are plants that have some benefits. There are plants that do things for you, and they have side effects. Do you understand? Everything that has like is a drug.
Has a get advantage,
get disadvantage. Exactly. Do you understand? And every drug that you take has a side effect.
Of course.
Do you understand? So there are plants like that. What are we saying? Malaria, ACTs, artemether combination therapy, is gotten from a plant first discovered in China, in like the East, Asian part.
Yeah.
I think it's in China. Those guys are really good. What else? There are so many.
A lot of these are medicines that are in capsules. They have.
If I was a pharmacist, I would have known it. But I don't know.
Yeah, it's okay. So you're saying that early detection is very important. So parents should check themselves. Everybody should just go and check themselves, right?
Well, let's take it two parts. We know one. I'll tell you what happens in developed countries. So in developed countries, I told you that we already asked these questions. We already want to know some things from you. After those questions, they will guide our thoughts, and then we'll do what is called any indicator that this person probably has this condition or might have it. We'll now do the test. They do the genetic testing to check for the gene that causes it.
In developed countries.
But here we don't.
We don't have gene mapping here.
We
do you know what? Do you know this thing? A lot of times in underdeveloped countries, not because they cannot afford it, because they'll tell you that it's not necessary. Right?
That's a lie. That's a big, very.
That's
big
what
lie.
they will tell you. Which one is? We should eliminate.
Who will fund it?
Who eliminate malaria and others?
Who will fund it?
Who will fund it?
Healthcare.
They will fund it.
Who will fund it? That's the question. For
Are
every
you saying WHO will fund it, or you're saying who will fund it?
That's what I'm telling you. Who will fund? No. I'm saying who
You're
will,
me.
not WHO. Who will fund it? Healthcare is expensive.
Yeah.
For everything that is done, for every test that is done, money must come out.
Yeah.
Somebody is bringing out that money. In developed countries, that's how it works.
It is.
The NHS that is everyone is seemingly free. Everyone is bringing money. They're taxing you a lot.
Yes.
And you have access
and
to
then
healthcare.
we have donors. We have there are people who donate to this.
But here in Nigeria, nobody cares.
No cares.
So the point is, let's not dwell on spilled milk. I'll tell you what to do to protect yourself. Ask your parents. Talk to them. Do you understand? Do checkups. If I check your blood pressure and it's that high, I am going to send you for an abdominal ultrasound scan. If I detect it early enough, I can tell you what to do, what not to do, that to reduce or slow down the progression. Do you understand?
Yeah.
But I can only do these things when I am aware of what I'm dealing with. If you don't come to the hospital and I don't see you, I can't do anything for you.
That is true. Okay, now I've talked about what it is. I've talked about how, of course, it cannot be prevented because once you get it, you don't get out. And we're talking about how the major causes, which is the known one, through genetics, right? Well, a parent will have it and then you have it. So how does it affect? You've talked about the complications as well, right?
Yes. No, I haven't.
Okay, let's do that.
Aside the kidney.
Yeah.
Oh, sorry. So aside the kidney disease, one major thing that we also check for. So a doctor who sees you must run 2 scans. Okay. One is an abdominal scan, and the other is a brain scan, a brain MRI or CT scan.
Why the MRI?
Now, one of the complications of ADPKD that is peculiar to it is what's called brain aneurysms. Okay. Aneurysms are outpouching of vessels somewhere. That's what aneurysm is.
And that if it bursts, that's the problem as well. Why is it always like that? Why does it cysts everywhere?
It's not a cyst.
It's like a cyst. It's like
well, yes, it looks like a cyst, but it's not really a cyst. An aneurysm is not a cyst. It's like when you take pure water and then you drag it parts, and then make it, and it bulges
And then the
because
fluids will be in there, right?
there will still be fluid. The blood will be flowing through it. It's not fluid, it's blood.
Blood.
It's a vessel. It's thin. So one of the things that they see is that it just swells. It comes out. I don't know how to. It will get
bulges.
yes, it bulges. Yeah, and it can rupture because, just like that pure water, the more it bulges, the thinner
the elasticity just snaps.
And then any small thing can cause it to burst and it can cause a stroke. So any doctor that sees you is aware of this, that you must run 2 tests. If a 29-year-old lad comes in and we've run the abdominal ultrasound scan and he says, this guy has ADPKD, we must run that brain scan, or brain MRI or brain CT scan. Mostly brain MRI shows us, gives us a clearer picture.
All right.
So we must run those 2 scans. And if there's no aneurysm, you must be running those 2 scans like every 5 to 10 years.
How much is 5 to 10 years? Okay.
Do you get? Okay. It's just one payment. It's a lot of its cost, but it's just one time.
All right.
In like 5 years. You get.
So what next?
So that's just it. And you now know, okay, we've done it and there's no aneurysm. Okay, we run it again another 5. If there's aneurysm, we can begin to find treatments.
So when one has it, you know that the person has it. You know, you have confirmed, diagnosed it.
Yes.
What complications can arise from having ADPKD? It's the same thing as having a kidney disease, right?
Yes, exactly.
So what are those complications?
So, as I said, the symptoms that you would see of kidney disease. One major complication is what's called end-stage renal disease.
Okay.
So
you mentioned that in the beginning of the show.
Yes. End-stage renal disease is just when your kidneys are no longer functioning. Sorry, when someone's kidneys are no longer functioning. So when that happens, the effects are astronomical. So I'll tell you about some of the things I witnessed. So, okay. Nephrology is a very difficult specialty because you get close to patients and you lose patients. If you attach yourself to patients, because usually my medical officers, myself and the other medicals, are usually the ones that come in contact with patients more often than not. So we get attached to patients.
Isn't that against, you're not supposed to attach yourself to patients?
But bro, I don't know what I will do. If I'm talking to you every day,
empathy comes
in.
Yeah.
If I'm talking to you, I saw this 24-year-old girl that every time that had kidney disease, and every time I see her, I'm always like, hi, how are you? I always want to know about her because how
can
would
make her better, right?
You get it can help. If I just talk to you, I have my patient. They have to come and chase patients away from my consulting room because we will just be gisting. You just be there. Patients will just come. Dr. Emeka, let me tell you about this particular patient. I'll come and start telling. He will tell me everything. Wow, there's someone that was telling me how he was a soldier and how he was in the academy. No, there was this another one that was just telling me about. You learn, you hear stories. It's exciting. I find it exciting to just talk to these patients. It's fun, but when you now lose these patients, it hits you.
It does.
It hits you hard. Some on the 25th of December, I was on call and there was this patient that came in and she didn't make it. Because there were a lot of factors involved. It was already too late and was
that must have been hard to hear.
When the nurse that watched over her, she watched over her from 1 a.m. Very fantastic nurse. She watched over her from 1 a.m. to 7 a.m. That patient passed on 7:20 a.m. December 26, 2023. This 2022. When she just said she was supposed to hand over to the incoming nurse because we did night. She just said, I will tell you later. She was going to cry. It was a lot. Even me that I'm hard guy, nothing they shake me. I'll continue I must do. If someone doesn't do it, who will do it? You know, that's my take on it. If someone doesn't do it, who will do it? It shook me that day. It shook me. Just know that it shook me.
It has to. We will have to be stones not to feel these things.
It was wild.
So now, if they're talking about, that means yes, they can. Other organs can also shut down when a kidney.
Yeah, of course.
Is not functional.
There's a lot of things that can affect. So kidney disease can affect the heart, can affect the brain, can affect the stomach. It can affect. There's nothing it can't touch. You just feel. You feel bad, they're always feeling weak. It can cause anemia. the uremic symptoms I mentioned, affecting the heart, causing some issues with the heart, can affect the brain. And then there's this psychological effect, because you have to always come in for dialysis. You have to source for funds for kidney. Bro, these things are expensive in Nigeria. Kidney transplant is like, it's a lot. Let me just tell you that it's a lot of money. I mean, I don't want to say what the amount is on radio.
Okay, so let's talk about cure. Is there any cure? If there is no cure, how is this managed?
Is there a cure? So, the books describe the definitive the definitive treatment, called definitely that's supposedly the cure. But the definitive treatment for kidney disease is kidney transplant.
Okay.
Do you get? So
that means there is won't call it a cure.
It's not. It's transplant.
You can't cure the kidney. You can only remove it.
You can only remove it and replace it.
So when there's no option for that, when there's no kidney available yet, how do you manage that situation? Dialysis. What KD? That is autosomal dominant site and polycystic kidney disease. This is a mouthful. Let's see if this caller has okay. If you have any questions for the doctor, all you have to do is call 09136000410 or send a WhatsApp message or an SMS to that same number, 09136000410. So now, what is your message to individuals, to parents, concerning this particular disease?
You have to take care of yourself. I always say it, like, you have to take, like, it is important. You have to take care of yourself. You have to check your blood pressure. You have to check your blood sugar. Avoid things that are known to, like, damage the kidneys. Run away from them. If you are taking, as a lady, if you are taking ibuprofen, we're talking about ADPKD. I'm talking about kidney disease in general.
Yeah.
So let me focus on ADPKD now. Ask questions. These are some of the things you must do. Ask questions. Then check yourself regularly. Do you understand? Come in, let's do some check. Check your blood pressure at the very least. You understand? Blood pressure. These things are not expensive. Come and do regular checkups. These tests are something you will do once in 6 months, and it's 12K.
It's not even up to one.
It's not street. You understand? It's not up to any hair that you are buying. Come, let's do it. Avoid things that can damage.
Okay. Please turn on the volume of your radio set.
Hello.
Turn down. Put off your radio, please.
Hello.
Okay, good morning. Your name and location, please.
My name is Juliet from Lagos, Ejibo.
Okay, Juliet, go ahead.
Please, I want to ask a question about this, the kidney disease.
Okay.
Is it possible somebody that they just detect kidney infection newly, he starts going dialysis, can the thing later balance?
Can the thing later get balanced? Okay. Okay, keep listening, and the doctor will give you an answer.
So that's a question everyone always asks me after a couple of dialysis sessions. And I will say this because it's the same thing I'll tell the patient. There's nothing, I'm not God, so I cannot say something with all certainty because I'm not God. But in all my practice, which, well, is not very significant compared to some of my organs, I will tell you that it's rare.
For it to balance.
For the kidneys to go back to it. It is not impossible, but it is rare.
Is the kidney regenerative? Does it regenerate?
It's only the liver that can regenerate.
Okay.
The kidneys can't. Once it's gone, it's gone.
So that dialysis is just to manage the situation.
No, yeah, dialysis is a form of treatment as well. It's just like it's like a baby brother to transplant.
Okay.
If we do transplant, that was also a form of treatment.
So are you saying that dialysis can happen for the entirety of the person's life?
Yeah, there are patients who dialyze for 40 years, 50 years. There are patients who once you are in a place that makes sense. I have this patient that has been dialyzing for the past 20 years.
And
he has a dialysis machine in his house.
And none of those patients go to a point where they didn't need dialysis anymore.
No.
Where they don't need dialysis is when they do the transplant, yeah?
Yeah, when they don't need dialysis, when they do the transplant, right?
Okay, this is really sad to hear, and please take care of it. I don't know why we need to be begging people to take care of themselves. Yesterday I went somewhere, right? But because of I shouldn't just be there without doing anything. I was alcoholic, right? Listen. So I took the cup, and it didn't even look. There's no flavor, like just a bunch of liquor that they poured into the cup. I took a couple of sips, but I said no. Some people say, now my money, how much did I spend on? And I bought it at an expensive price.
Yes.
I could have said, okay, it's my money, let me finish the money. But finishing that money was a no-go area. Didn't I only took about 2 sips of that, and I stopped drinking that.
Lilian, I appreciate you for not drinking that alcohol. But let me tell you now, because it's live. I will not say don't drink alcohol, but don't take it in excess.
You're not getting my message.
You did now.
Give them do you know that at a point, whenever I go out with a guy and I want to take something soft, the guy will tell me, I cannot be buying something soft for you. Many men will not buy something soft for a lady. I'm not kidding.
Why?
They'll say, I go there, yeah, they will drink this. You have to take alcohol. And that's why a lot of ladies take alcohol, because they don't want to buy anything soft for you. You're on a date.
What does that mean? Oh God,
I'm not
you are on
kidding,
a date. If someone takes, if a man takes you out on a date, it's whatever you want that you will get.
Well, I know what I'm saying. Hello, you're not a lady. Hello.
Hello, good morning.
Good morning. Your name and location, please.
Hello?
I can hear your name and location. Network is bad. Can you hear me? All right. You can try calling us back before we leave. 091-36000410. And now, is there any way that you think the government can make this easier on Nigerians?
Yes, like
hold that thought. Hello.
I need to talk about it.
Hello?
Yeah. Good morning. Your name and location, please.
Hello?
Can you hear me? I think you should just send an SMS. So as you were saying.
My consultant, my clinical director, is always saying this. They need to subsidize dialysis. They need to subsidize the treatment for kidney disease. It is one of the things that is rampaging. It's like it's eating us alive. Like if one person in a family has is dependent on dialysis, if one person, the entire family will feel it. So if in places that work, what thing they do, dialysis is mostly free or it is ridiculously cheap. So because they know that sometimes they might not catch everyone, but if they reduce the economic or the financial implications of that disease, then the symptoms can easily be controlled. There's an average person that is on dialysis spends up to 450,000 naira in a month. If you are going to ideal, it's a lot of money. So if they subsidize this kind of treatment,
then it will be easier on the Nigerians. Please turn on the volume of your radio. Hello.
Hello, good morning to you.
Good morning. Your name and location, please.
My name is Bakari.
Okay, Bakari, go ahead.
I'm calling you from the Third Milan Bridge right now.
All right.
What I'd like to ask is simply that I want the guests, the experts, the doctors to help us take a time to list out how exactly to take care of yourself in such a way that you can prevent kidney disease. Carefully dilute what are the things to do, what are the things not to do to put yourself in a safe state from kidney disease. I just want to be careful.
Okay. We would have done that on a normal day, but we're already running out of time. So, but what do you think, doctor?
There's only one thing I will say. There's only one way. There's the quickest, fastest way. Go and see a doctor.
All right, go and see your doctor. This is the voice of Dr. Nwadinigwe Emeka, the Chief Medical Officer of Zenith Medical and Kidney Center in Lagos. And we have been talking about autosomal dominant polycystic kidney disease, which if you want somebody in your house have it, you are bound to have it. Okay? All right. My name is Lilian, and this is Health Plus every Friday, 10:15 a.m. Stay tuned for more content on our radio.